And Sherwin joins us now for the very latest. So, Sherwin, what can you tell us about what's happening at the moment, particularly around the U.S. president's health?
Yeah, well, let's take the president at his word, Tsepiso. He tweeted a short time ago saying that, folks, I'm doing great. Thanks for your concern. He said he called various lawmakers on whom he had to cancel engagements today. The president was due to be in Pennsylvania for an anti-gun violence initiative. Of course, yesterday traveling to the state of Massachusetts, to Somerset, Massachusetts, where he spoke on climate change. So certainly in the midst of those travels, he contracted COVID-19, but apologizing to those lawmakers that he couldn't be with them in person today in Pennsylvania. But from the White House, we understand that the president is continuing to work from his isolation in the residence of the White House. He's apparently been making calls and attending planned meetings via Zoom. Let me read you what the president's physician has released. He said that this morning, as part of routine a screening program for the president, SARS-CoV-2 virus was detected in an antigen test that then followed up with the more reliable PCR test, which confirmed the diagnosis. On questioning, the president was currently experiencing mild symptoms, mostly a runny nose and fatigue, Tsepiso, with occasional dry cough. These are very regular, commonplace symptoms when we talk about COVID-19. These symptoms, we're told, started yesterday evening, so probably on his way back to the White House from that climate change event in Massachusetts. The physician has recommended that the president go on this antiviral oral medication called Paxlovid. Paxlovid is an antiviral medication that reduces the chances of serious illness and hospitalization. But it's also worth noting that the president has been fully vaccinated and received 2 booster shots because he qualifies for the second booster shot, being over the age of 50. Of course, the president's 79 years old, so in that high-risk category. But the White House coronavirus response coordinator, Dr. Ashish Jha, came out to talk to reporters after having a conversation with the president. This is some of what he had to say. Watch.
After he tested positive, he reported these symptoms that have been described. Dr. O'Connor examined him thoroughly. He found his exam to be normal, to be at his baseline. And then obviously he recommended that the president take Paxlovid. The president accepted that recommendation and has started Paxlovid and has taken his first course already. I want to also just take a minute to sort of mark this moment. You know, because the president is fully vaccinated, double boosted, his risk of serious illness is dramatically lower. He's also getting treated with a very powerful antiviral, and that further reduces his risk of serious illness. And it's a reminder of the reason that we all work so hard to make sure that every American has the same level of protection that the president has, that every American has the same level of immunity, and why we have worked so hard to make sure that people have access to life-saving treatments like Paxlovid.
Dr. Jha also saying, Tsepiso, that they have sent the president's test for sequencing to really understand what variant he might have contracted here. But of course, the variant that is the subvariant of the Omicron coronavirus that is currently predominant in the United States. Some 70 to 80% of infections are being attributed to the BA.5 variant. So very likely this is what President Biden has contracted, because it is highly transmissible. I can also tell you that First Lady Jill Biden is on a visit of her own to Detroit, Michigan today. She arrived there and spoke to the media briefly, saying she spoke to the president, that he's doing okay, and that she tested negative for coronavirus earlier today. Tsepiso.
What was interesting about what Dr. Jha was emphasizing was the need to extend this type of access to Americans in general, showing, as you know, that we've started taking off our masks here. In fact, you virtually hardly see a mask in sight, but people are refusing to accept that, you know, people are still getting COVID-19 as we speak. So just paint a picture for us how people are going about it in the US, and what did Dr. Jha have to say about just going forward managing?
Yeah, we reported earlier this week, Tsepiso, about how numbers in the United States are going up. I think today we saw about 200, in fact, yesterday over 200,000 new cases, averaging at around 120,000 new cases a day. The deaths have hovered since April between 300 and 420 deaths per day. So that's down from those peaks when you were hitting 5,000, 6,000 deaths per day, but still too high. And we understand that the number of fatalities are coming from states that most of the fatalities, let me correct myself, coming from states where you have the lowest penetration of vaccinations. We are in the midst of a heat wave in the United States. There are heat wave emergencies affecting about 100 million people, about a third of the population in this country. So it's very hot, Tsepiso, in addition to people having to wear masks. So, given the fatigue over the almost 2 years that we've been at this now, I think there's a great deal of fatigue. It's very, very hot in many parts of the country. So here, too, it's very difficult to see and certainly enforce mask mandates on people that are just very tired of COVID-19. The recommendation, the official word from the coronavirus response team in the White House is that in public spaces, indoor public spaces, the recommendation is that people wear masks, but that's not necessarily being enforced. I mean, different localities, 50 different states, Republican versus Democrat. So the rules are very different across the country, but you can now travel on aircraft, in public transit without a mask, and there will be no penalties for that. So we are in this gray area. I think part of the complication as well, Tsepiso, is that we talk about the post-pandemic when we are in the midst of a pandemic, right? So we need to start, as journalists, our responsibility is also to articulate these things factually, and we are not post a pandemic. We are in the midst of the pandemic, and the President of the United States that has received every vaccine that he's eligible for speaks to that. We have another clip from Dr. Jha. Let's listen to what he had to say.
Right now, he feels really well. Our expectation is that he's going to continue to have mild illness, and he's going to be monitored for symptoms. I mean, you ask him, kind of every day. I asked him, how is he feeling? Is he having any other symptoms? He's not. And I think we're going to continue monitoring that, and I don't I think that is the plan right now, is that he's going to get care the way he would. I was going to say the way he would any other person. He's the president, so obviously he gets extra attention, but. I don't think we have any expectations of any other symptoms at this point.
So with these new variants, BA4, BA5, Omicron, remember we started with Delta and who knows what other iterations of COVID we've had over these 2 years. The message, Tsepiso, is that if you are double vaccinated and boosted if you are eligible, it reduces the chances of hospitalization and the chances of severe illness, and I think that is the point. Vaccines don't necessarily prevent one from contracting COVID-19, but it does prevent severe illness, and that is the point. What we are also learning now is that the FDA is in the midst of a decision of approving a next-generation vaccine that will deal specifically with the BA4 and BA5 variants. So that is something that will be rolled out in the months ahead. They say by the end of summer into the autumn months here in the United States, so around October. So there's a new generation of vaccines that are going to come to market in the near future, and that will increase our mitigation efforts against these new variants that are emerging. But of course, like the flu, this is a moving target for us, and many thought we'd reach herd immunity by now, but variants are putting a spanner in the works, if you will, Tsepiso.
All right, thanks, Sherwin. And speaking of generations, I've noticed that quite a bit of copy has been mentioning President Biden as the oldest governing president of the United States, just speaking about his COVID-19 status. Was an interesting twist to it, but thanks a lot for that.